Good afternoon and welcome back at ECCMID TV. My name is Judith Cohen. I'll be your host for these ECCMID TV broadcasts. And I'm very, very pleased to be welcoming into our studio live Dr. Martin Blaser, who is holding the Henry Rutgers Chair of the Human Microbiome, is a professor of medicine and pathology and laboratory medicine at the Rutgers University, and is in, I think, 45 minutes from now in Hall A, holding his keynote lecture with the title Pathogens in the Microbiome, Antibiotics at the Crossroads. So very warm welcome to you, Martin. Very happy to have you here. Could you start off by helping me out a little bit? What do you mean that the antibiotics are at the crossroads, as you state in your title of your upcoming lecture?
Well, thank you for interviewing me. I'm happy to be here. Now we're about 75 years into the antibiotic era, and everyone sees antibiotics as miraculous, and they are, for a small number of people who have life-threatening illnesses. But it's become very clear that we're overusing antibiotics for people who don't need them at all or who have very mild illnesses. And it is becoming more and more clear that antibiotic use has cost, that it's not free. It's not like this won't help you, this might not help you, but it won't hurt. We're learning that antibiotics have effects on the microbiome. And those effects can be short-term, they can be long-term, and they can, we believe, lead to important diseases.
And do you believe that the effects on the microbiome, can they happen with like your first course of antibiotics? Or is it with a long time standing overuse of inappropriate?
The effects on the microbiome can happen with a single course of antibiotics.
Really?
But their antibiotic effects can be cumulative. So more days, more courses, more effect. Because antibiotics work by suppressing or killing microbes. And they were designed to kill microbes. But no one really thought about the collateral effects of antibiotics on the normal microbes of the human body. And it's clear that there are effects, and the effects can be long-lasting. And it's especially important in children, because their microbiome is part of their development. The microbiome helps their immune system develop, metabolism helps the brain to develop. And if you alter the microbiome at a critical time in development, you alter development as well.
Yeah, and there's a lot of antibiotic prescribing in children. Well, it's of course dependent on the country the clinicians work in.
There's antibiotic prescribing in children all over the world.
Yeah.
But the amount of variation is huge and can't really be explained on medical grounds. It's really cultural and practice of medicine. In Europe, there's a north-south gradient, that people in southern parts of Europe prescribe much more antibiotics than the northern part, sometimes double or triple.
Yeah, so you've been studying the microbiome for over 20 years, I believe. And there are many relationships between the human microbiome and, certain diseases such as asthma, obesity, diabetes. So when you say that antibiotics can change the microbiome even after a first course, are there also ways yet discovered to change it back or to make certain adaptations? Yeah. Are we there yet?
Yeah, so we're first trying to define the problem and exactly understand what are the mechanisms, what's the extent of the problem, and at the same time, we're studying how to restore the microbiome after it's been perturbed.
Is it possible?
Certainly it's possible in mice, and there's evidence that it's possible in people too. The first evidence comes from the use of fecal transplants in people with C. difficile infection. That's the proof of principle. That means that if you have a disordered microbiome and you restore it, you cure the patient. So that really points to the importance of that. That's a very specific and acute situation. More complex is if having a damaged microbiome in a child makes them more at risk for asthma or obesity or autism. Now what can you do? Can you turn it around, and what's the window of opportunity? Is it the next week, or is it 2 years later or 5 years later?
Yeah.
That's what has to be determined.
But do you believe that the disease that has risen under the change of the microbiome is also reversible? Because that is maybe less achievable than reversing the microbiome.
I think that the longer the disease has been operating, the more difficult it is. And so in English we say an ounce of prevention is worth a pound of cure. A lot of our work is designed to understand prevention.
Yeah. So what is the development you believe the most in, or you're looking forward to the most for the upcoming next years concerning the microbiome, antibiotics?
I think we already have the big picture. It's clear that antibiotics perturb the microbiome in both adults and children, that there's a lot of individual variation. We have to understand kind of the rules of perturbation and the rules of variation so that we can restore it. I think it's unlikely that one size will fit all.
Yeah.
That we'll be able to give the same thing to everyone, but maybe we'll classify people in 5 different types.
Yeah.
And I'm obviously just making that up. And then for a type 1 person, the restoration will be A, and for the other it'll be B, et cetera. So we have to understand better, we have to develop diagnostics and therapeutics. They go hand in hand.
So where will we be in 5 years? What would you expect? Will we be able to phenotype already then, or?
There are so many things that have to be done. We've been in the antibiotic age for 75 years with great effects, but in a way, in terms of our ecological depletion of the microbiome, we've been digging a hole for 75 years. And my goal is that we don't dig the hole any deeper, that we even out and then we start filling it in.
Yeah.
And one of the things that is potentially achievable is that we have to develop narrow spectrum antibiotics. Not antibiotics that have wide collateral effects, but antibiotics that are just targeted on the pathogen in question. And I think that's it. With everything that we know about genomes, we could probably develop such agents within a few years. Maybe there are 20 pathogens, bacterial pathogens, that are very important. We could develop one for each one.
But if you describe that a microbiome can be changed by a single course of antibiotics, that doesn't apply just for the inappropriate antibiotic or the one that wasn't, but for every antibiotic, right?
Yes, that's right.
Yeah.
But it turns out that in children, at least half the antibiotics prescribed are unnecessary.
Yeah.
We could start with those.
We could start with that, definitely.
Right, and that would help.
Yeah, yeah.
In fact, one of the very interesting things about COVID is that because there was less contact from child to child and less viral infections, there were a lot less antibiotics prescribed.
Yeah.
So in some ways, COVID was good for the microbiome because
absolutely.
of less antibiotics.
Yeah. Is it going to be interesting to see how the microbiome has responded to that period of pandemic with lesser viral exposure?
Yeah, I think that's a really good question. We've been doing some work on COVID to try to understand, is there some kind of microbiome signature that puts people more at risk for more severe disease or not? And that work is ongoing. But by and large, in our preliminary work, the microbiome was pretty resilient to COVID. Didn't change that much, even in people who became infected.
Okay. That's really interesting matter. So you're going to hold your keynote lecture in just a little bit. And also today, if I'm not misinformed, you will be holding or hosting a fireplace session. That's correct?
Yes, whatever that is.
Yes?
I'm looking forward to it.
Well, we have fireplaces. No.
I
think you get the opportunity to...
I hope I won't be burned at the stake.
No, you probably won't be burned at the stake. No, I believe that the whole opportunity is for younger investigators, researchers, or interested minds, to have the opportunity to talk with someone with over 20 years of experience in this field and pick your brain a little bit and learn from you. But I can imagine that it's interesting for you too to speak to young, unexperienced or lesser experienced people. Is that something you look forward to? Or?
Absolutely, and in particular, this field that I'm talking about, the microbiome field, is a young science.
Yeah.
And the big developments are in the future and will really affect the careers of the young people in this room. the developments will come 20 and 30 and 40 years from now.
Yeah. Well, it was a pre-registration for the fireplace session. I believe it has been filled up. So
Oh, great.
all our other viewers may be looking towards it with a little bit of jealousy. But hopefully they can join you in Hall A for your keynote lecture at 2:45, which is in a little bit over than half an hour. I'd like to thank you for coming here to our TV studio to give us some more information about what you're going to be talking about, the interesting topics you're going to be discussing. So thank you very much for coming here. And for our viewers, I would like to, stress the importance or the relevance of going to see this keynote lecture. It was highlighted by Professor Jacob Moran Gilad this morning as well. So I think it will be a very interesting topic to go watch. We will tune out for now. We will be back with you at 3 o'clock when we will be showing some of the artwork some of the ESCCMID members or ECCMID attendees have submitted for the ECCMID art gallery. So that will be really interesting to see what inspired them to create their pieces of art or poetry. So please tune in at 3 and we will be back with you then. See you then.